Okay, so welcome everyone. I'm very happy to welcome you all to this webinar on deliberate practice in rational emotive behavior therapy. My name is Alex Vaz and I'm with my good friend Tony Rumenaire, and we have three wonderful guest experts for today, Mark, Christine, and Raymond, who I will present in just a minute. I'm just gonna give a quick shout out, and Tony, do you want to actually give the quick shout out here to the council?
Sure. Yeah. Alex and I are with the Sentio Counseling Center. We are an online counseling center and training site in California where we provide very low fee online counseling for California residents, starting at $30 a session, teens, couples, and adults. And we also do advanced training for supervisors in deliberate practice. So if either of those interest you, please visit us at the website on the screen. Thank you, Alex.
Great. All right, so without further ado, let me give a brief presentation of our guest experts. Because they've done a lot in their professional careers, please activate your unconditional other acceptance towards myself as I go through their numerous achievements. Mark Turgeon is a professor of psychology at St. John's University and a core member of the school psychology programs, previously serving as director. He was a child and family service coordinator at the Albert Ellis Institute for Rational Emotive Behavior Therapy in Manhattan and was president of the school division of the New York State Psychological Association and of the APA's Division 52, which is the International Psychology Division. Christine Doyle is the director of the Albert Ellis Institute and director of clinical services and a licensed staff psychologist at the Albert Ellis Institute. Dr. Doyle is a co-author on the Practitioner's Guide of Rational Emotive Behavior Therapy, the third edition, and a co-editor of the Journal of Rational Emotive and Cognitive Behavior Therapy. She is also an external examiner of the Masters in Rational Emotive Behavior Therapy at Goldsmiths University in London. And finally, Ray Giuseppe is a professor of psychology and chair of the Institutional Review Board of St. John's College of Liberal Arts and Sciences. He has promoted and recognized anger as a form of psychopathology and promoted research of diagnosis, assessment, and treatment of anger problems. Dr. Giuseppe has published 2 psychological tests assessing dysfunctional anger and works on the development of the theory, practice, and empirical research support for rational emotive behavior therapy and cognitive behavior therapies. Thank you all three for being here with us today. Right. So let's just this is the single slide that Tony and I want to put in before we jump into the specifics of REBT and the lower practice in REBT. There's a long tradition of learning research and more recently psychotherapy research on the difference between what may be called conceptual learning versus procedural learning. Conceptual learning being the kind of learning that you do through reading books, through attending lectures. You may even, in our case, watch therapy videos or therapy recordings. Basically, these are reflective activities, right? So conceptual learning is you learning about the theory or a model or a clinical skill through reflection of different resources. Now, that is very important, but it contrasts with procedural learning, which in a less jargony way, you could say learning by doing. And what's been found over and over in decades of research is that to achieve professional expertise in most fields, we need to integrate our conceptual learning with procedural learning. In the case of psychotherapy and mastering any model of psychotherapy, including rational emotive behavior therapy, that would mean not just reading about REBT and talking about REBT and discussing cases, as interesting as that is, but also practicing procedurally, experientially, the skills that make up for good therapy. And what we found is that in most training programs across the world, there's a high percentage of conceptual learning resources, but very low percentage of procedural learning that is being done with trainees. So what we've set as a mission for ourselves with our guest authors for today and also other authors is to develop more procedural learning resources so that people around the world, be it trainees, be it supervisors, professionals, can practice the skills of REBT and other models to get it in their bones. So not just think about the skills, but actually practice them. As part of this building research and theory of the lower practice meaning this learning by doing, systematic skill building, we've been putting together a book series for the American Psychological Association. This book series has already put out a number of books, and Tony and I have had the luxury of working with experts from all of these different models, all the way from psychodynamic to emotion-focused therapy, schema therapy, motivational interviewing. And we're very happy to include in this series rational emotive behavior therapy. I would be remiss to not include by saying that in my own teenage years, rational emotive behavior therapy was incredibly important in my personal life. So I remember telling Tony, please, let's make a case for including REBT in this book series, and I'm very happy that we did. So the book has been written, led by Mark, Christine, and Raymond, and it'll be out hopefully next June or July. And this is the table of contents for the 12 skill building exercises present in this lower practice book. So each of these books in the APA series of lower practice has 12 skill building exercises that provide opportunities for role play, repetitive role play, so that you don't just think about the skill, but you actually have to practice it, rehearse it, and get feedback on it so that you can refine your use of the skill over time. And we're going to go over in a minute about over these 12 skills. I'll go back to this screen just in a little bit, but I want to first throw a more general question to our guest experts for today and ask them, Ray, Mark, Christine, how do you think that the lower practice adds or complements those who want to learn REBT? What does the lower practice add in any way to REBT teaching?
So let me field this question. I think that REBT has been always been involved in deliberate practice. Since about 1975, we've always trained therapists in a very expensive way, where we have half of our day being conceptual presentation, and the other half what we call peer counseling. So in REBT, we hook people up together. I'd be hooked up, let's say, with Wendy. He would present the personal problem, and I'd be the therapist, and then I'd present the personal problem, and he'd be the therapist, and then we would role play or do the therapy and give people feedback, and there'd always be a supervisor present. So we've been doing this since about 1975, and we've always thought that, therapy is not just a conceptual process, it's really a motor skill. I like to think of it as an athletic skill, because when the client presents you with a certain kind of information, you have to do something, and not doing something usually involves, losing the client and losing the therapeutic alliance. So we really do have this practice. And we've done it a number of different ways over the years. We used to do it with audio recordings, because Carl Rogers really revolutionized the field of psychotherapy by bringing a tape recorder into the session. And we found actually that wasn't so great. We got a better way, because people were practicing for 5 days and doing it on recording, and then they practice, and then they listen. They do it the wrong way the next time before they got feedback. So we've tried to do things where we give more immediate feedback. So we originally decided not to do so much technology, and then we really decided to do a little bit less technology. And now we're really doing it more online, where people, though, learn the conceptual things online, but then they have to get more immediate feedback. So what we've learned over maybe like 50 years is the more immediate feedback you give therapists, the better that they do. We've also found that there's an uneven development. Like we've run these 3 or 4 day practicums, and people will usually learn what they're doing from a demonstration, and then they do it. They do a little bit better, but there's always a dip where they lose a little bit of their skills. That usually happens on about the 3rd trial. They kind of get a little bit more confused, and then they have to think it through and practice it again, and then they do it better. So we've sort of seen an uneven curve. It doesn't always go up the way people would do it. I think that working with this project, we've learned a couple of other things. I think that sometimes we do too many skills too quickly. And what you guys have really taught us is that we want to slow down a little bit, and that we want to, think about the skills. So I think our biggest discussion in doing this book was, how do we squeeze more skills in? How do we do more things? And that might have been one of the things that we're improving at. I think it's better if we have fewer skills and give people a little at a time to do, and that we could easily overwhelm them. So I think we have always believed in modeling and rehearsal and feedback. And I think that REBT supervision has really spent a lot more time talking about what the therapist has done, having the therapist, show us what they've done in recordings, and then maybe some modeling by the supervisor, and then having the client go do it and show us that they can do it. I think with the direct practice, we have been able to develop these little skills to have them practice it before they go out and see a client. So I think that's something that we've learned by this process. So overall, I think REBT has taken well to the deliberate practice model. I think we've been involved in deliberate practice model more than most forms of psychotherapy. I think we've learned a lot about how to teach REBT from the feedback that we've gotten. And I think we're changing the way we do it from the collaboration in this deliberate process model. So I think that's what's happened.
I want to highlight something you said, Ray, because I think it's very important. You've always been involved in some way in the practice of skills and rehearsal. And one thing we've noticed across every model, not just REBT, is that very experienced supervisors tend to interweave different skills in such a seamless way that they might not even realize they're doing 5 micro skills in a single intervention. And so that's wonderful for the therapist and for the client experiencing that. But for a trainee, that can get pretty overwhelming pretty quick, right?
Yes, I think it's like hard as an experienced therapist to be aware that I just did 3 things,
Right.
And that the new therapist just didn't pick that up and didn't break them down into the pieces. And so when they try to reproduce what you've modeled for them, they miss it because you think about it so quickly. And I like to think of it as sort of an athletic metaphor. If I practice 100 turnaround jump shots, I do it so quickly that it doesn't really hit my consciousness. And if it doesn't hit my consciousness, I can't tell you what I did. Right. So supervisors, I think, have to be better at breaking their behavior down into skills. And I think that's hard for experienced therapists. And this process helps us think about that and break it down.
Amen.
I would say just to chime in here to Ray's point, I think Ray and I, more so than Mark, we had our weekly or monthly therapy sessions with Alex about moving to the deliberate practice model and the mindset of giving up the conceptual idea versus the procedural, which was definitely hard for Ray. You and I, we had trouble with this, and you were really helpful in that regard, assuming that they're going to get that learning, that conceptual side on their own. And we're really focusing on are the steps that we have in REBT, but the micro skills that go along with those steps. And so I think there was like a split brain phenomenon for me, like separate the 2 out and focus in and really just try to move out that they're not going to have the theory. They'll have the theory, but this is about repetition, which is what we ask our clients to do, right? Repeat, rehearse over and over throughout our sessions. It's the same thing as a deliberate practice practitioner in terms of REBT.
Yeah. I hear echoing in my head, Al Ellis, the work and practice, right? Insight is not enough.
That's right.
Right. I think, and I think that in addition to the motor skill, I think that part of this situation is also perceptual learning. In other words, when a client says something, you have this big conceptual model in your head and you try to implement it. But when the client opens their mouth, is that an activating event or an emotion that they just said? Is that a behavior that they're doing or a thought? And that the perceptual learning to figure out, oh, the client just gave me a new situation that they're having a problem with. And oh, now that helps me fit in with the skill set of which skill I want to implement. So perceptual learning and motor learning, I think, are the things we need to do. We focus too much on the broad conceptual models and not on the smaller steps.
And Alex, I would add, Alex, it's also the different levels of competency that people want to develop. Wendy Dryden created this terrific competency scale. But how do we know when somebody is competent? And this lets people practice and then see a model response to some of these different situations where they can develop their skills and review how competent they're becoming in each of these different 12 discrete skills. And then they pull them all together in some of the clinical work as well. And I think from some of the pilots we did from some of these different vignettes, which we'll go through in a little while, we got good feedback from very seasoned clinicians and from very novice clinicians about how they were doing in terms of developing their competency in these different skills. So the process of writing this lent itself to REBT quite well, given the history that Ray and Christine had just spoken about. But I really think from a training perspective, this is going to have big implications for both initial clinicians, but also for more seasoned clinicians who want to really review, am I still only doing one dispute? How do I go about developing other disputing techniques? Where am I struggling from a competency standpoint in the practice of REBT? And I think the book lends itself quite nicely to that.
I mean, that's a perfect segue, I think, to jump into the specific skills that you guys focused on. Because like we mentioned, the idea is that this book is not a comprehensive skills manual of REBT, because of course there are too many skills in REBT to include in a single book. But we try to choose skills that most trainees and therapists both need to be able to achieve competency in, want to train in order to perform good REBT, and also those that a lot of trainees have a hard time doing. Even if conceptually they understand the skill, they can write a good paper on the skill. When you actually see them do it with an actual client, they might fumble through it a little bit, right? So we focused on these 12 exercises. And again, I'd like to throw it to Christine, Ray, Mark. Could you say a little bit about the process of choosing these particular 12 skills for your book?
I think the first skill is really important, that REBT is very much based on Stoic philosophy and the belief that the way you think influences your emotions. Now, if an event occurs and I'm perfectly rational, I may have a negative emotion, but it's probably going to be a non-disturbed emotion. And so we really are hypothesizing that the irrational beliefs are going to lead to disturbed negative emotions. And so in this introduction, we really could have a number of different skills. One is the distinction between a disturbed negative emotion and a normal negative emotion. And lots of people really get the model wrong. The Stoic philosophers talk about stoicism with the small s, which is the belief that you shouldn't have any emotions. It's better to not have emotions. And we really want to emphasize that emotions are normal things, that all people have them. You want to have an emotion that's appropriate for the situation that's occurring, and that different beliefs identify or kind of go with different types of disturbed and non-disturbed emotions. So that first point is difficult and is also kind of loaded. And that was hard to write because there are a number of sub-skills that are really in it. So I think that's the most difficult one, I think.
Christine, can you talk a little bit about the process of getting to these 12? Because I know we had many arm wrestling sessions about this.
We did. We definitely struggled. It was real. The struggle is real. It was at St. John's University in that office, and we went back and forth, really hammering out what does a session look like, what are the key points. And I think we tried to negotiate with Alex and Tony about, like, can we have 14 or 15 skills? And the magic number was 12, and we went with it. But
we don't negotiate with terrorists.
We felt the same way, just letting you know.
We felt hostage.
So but it was good for us to narrow it down, and we realized that to Ray's point, there are a lot more skills, and that's for the second deliberate practice book that we're going to write. So we really tried to figure out what are the key points that we want readers to get in terms of what an REBT, not session, but REBT therapy would look like. And we did go back and forth, and we had many disagreements, not terrorist disagreements, just, intellectual disagreements. And we did come up with the 12 that we thought were the most important to highlight. But we want everyone to understand that we are not overlooking all the others that we didn't. Like, it was not in a vacuum that we did this.
Right.
Which
And
was a concern I had, because I was, concerned that if we don't get everything in to this book, people are going to think misunderstand our REBT. So that was also a struggle, to be honest. It was a struggle that I think we concluded nicely with.
I think the other issue, one of the skills is, to sort of set goals, and that we would like REBT to build on a lot of the common factors that Walpole talks about, and, agreement on the goals of therapy, explaining the rationale. Walpole argues that when you have a rationale for the client's symptoms and the client believes in that rationale, it's easier to have successful therapy. So as much as possible, we wanted to weave in common factors of psychotherapy to build on, rather than, because then some people think, well, I'm going to come in there and I can forget all that stuff that I learned in other theoretical models and just start, challenging irrational beliefs. No, you really have to develop an agreement on the goals. You really want to develop an explanation of the model. And we know that those things are effective in any psychotherapy. So we want to build on that knowledge base.
But Alex, you asked about the process of developing. Christine did a nice job of describing it. And I agree with Ray. We tried to filter some of those other skills in there. But then inside each skill, and this is one of the formats of the book that we like, but we did struggle with initially. How do you differentiate a beginning clinician from an intermediate clinician to a more advanced?
Yeah.
And so in that process, and Christine, maybe you want to talk a little bit about this, because this was your skill set, Christine. You got very good at this. What kind of prompts or situations do you want to provide that will elicit competent responses at beginning, intermediate, and advanced? Christine, do you want to talk about that for a minute?
Sure. It was, the two gentlemen that are on this panel with me gave me the advanced. So that was the hardest, because it's usually the most vague and where you have to really understand the theory, hear what the client is saying, and take from it and do, hypothesis-driven interviewing, right? So, so we kind of talked about a beginning skill, intermediate, advanced. Beginning is basically where the client gives you their irrational belief or hands you their emotion. The intermediate is where it's a little bit more vague, and the advanced is where they just tell you whatever they tell you, and you gotta really work for your money. Like, that's kind of what the advanced is. Like, you have to figure it out on your own based on what you know about REBT. So it was interesting doing the prompts for this, because sometimes because we use the same prompts throughout all of the different emotions that we were working on, and sometimes, like the intermediate and advanced, there were nuances. It was a little bit vague, and then it was really vague, and that's where you're going to build on on your skills, is to practice until you're able to go to the next step. So that's where we also were thinking about, we want to meet our trainees or the readers whatever level they're at, as we would do in a training, not go too far, right? So stay within the range where they're able to master, but also a little bit above that, and work with them and giving them feedback on that. So it was and the disputes that we chose, we chose 3 of many disputes, disputation questions. That was also a challenge, because depending on the emotional problem, sometimes a dispute was harder to create. But that's also part of REBT, is how do I dispute an irrational belief with one type of disputation question, but how do I word it differently? How do I change it so that I'm still asking the same question, but in a different way, so that the client gets that feedback and starts thinking about it and can affect change, basically.
And
I think we've all probably seen with trainees, they get very comfortable in a certain type of approach or technique, disputation, Christine, like you're saying, and like that's their fallback. I'm always going to do functional. Functional dispute works for me, but maybe it doesn't work for this client. And so what Christine was highlighting there was when we chose the different disputing techniques, we only chose 3 of them, and there are many more. We then show how to do the same different types of disputes for the same presenting problem, the same presenting belief of the client. And I think the reader will kind of get a feel for there's more than one way to skin a cat, and there's more than one way to challenge a belief. And we encourage readers to go outside their comfort zone. Like, okay, functional works for you most of the time. Try some of these other approaches. You really have a better chance of getting clients to give up some of their ways of thinking by providing with multiple models, which I think we do quite nicely.
Yeah, I think this is probably the perfect segue to give people an actual sense of what the deliberate practice exercise looks like. So going back to our table of contents here, so we could pick any of these, and beforehand, our guest experts agreed for us to focus on exercise number 7, which is teaching the belief consequence connection, a classic in the REBT toolbox. So let's look at what that actually means in the context of a deliberate practice exercise. So the way we create deliberate practice exercises is we take a skill that's often a very clear skill, but also needs to be decomposed into more concrete therapist behaviors so that they can be practiced, right? So what we call skill criteria, which are these numbered statements here, are the therapist behaviors, observable behaviors that define the skill that you're practicing. And this was a big part of the challenge that our wonderful experts had, was how to translate a lot of these skills into actual practicable behaviors, therapist behaviors, that is. So for this exercise of teaching the belief consequence connection, we have 2 skill criteria. The therapist has to make a statement that connects the client's irrational belief with its consequences. And second, ask a question that checks the client's understanding of the BC connection. So let's see an example here. So for example, we have a client prompt where the client says, I was so angry the other day as my brother had me go to pick him up at the airport and he never told me he took another flight. Now I'm not talking to him. I can't stand that he does this. Therapist could respond by saying, it sounds like when you think, I can't stand that he does this, it leads you to get so angry and now you're not even speaking with your brother. Is that correct? So notice this statement, this therapist statement meets criteria 1. It's a statement that connects the client's irrational belief with its consequence. Second, therapist says, does that connection of your thoughts to your feelings of anger make sense to you? And that fulfills criteria 2, asking a question that checks the client's understanding of the BC connection. Now, in normal deliberate practice, if you had this book, you have 15 pre-scripted client statements that one person would be playing. This is not free-form roleplay, so you're sticking with those client statements so that you can provide a stable ground for repeated practice. One person says the client statement, the other person playing the therapist improvises a response that meets those 2 criteria. Now, for the purposes of today, for this webinar, we're not going to be doing a role play per se, just because we have so many people here and we want to give people a chance to practice. So instead of having people say out loud their intervention, which would be the gold standard or practice, let's say, we're going to do something slightly different. We're going to invite any attendee who wants to try this out to write an example therapist response on the Zoom chat. So I'm going to be reading a client statement, and everyone who wants, try meeting those 2 criteria as a therapist response to what the client just says. Okay, so I'll read the client statement. I forgot to call my mother on her birthday and feel so guilty. Who knows how many more she'll have? I should have called. I'm such a bad person, and now I just ordered an expensive makeup gift that I can't afford. So I'm going to give people a minute. For those of
I
you
just
want...
put it in the chat too, Alex.
Thank you, Tony. try writing a therapist response that meets 2 criteria. And then our REBT experts will provide feedback.
Okay, so here's the first response. I'm going to read it out loud, and if we could just have some feedback from our experts. It sounds like thinking, quote, "I am a bad person," is associated with feeling guilty. Would you agree or disagree? If you disagree, why?
Okay, so I like that, Wally. First of all, Wally, thank you for joining, and I like that response. You definitely meet criteria 1. Like, so if you look at it, makes a statement that connects the irrational belief with its consequence, and then you're checking on the validity of that statement. The other part of, and maybe Alex, you can pull back the criteria again. Part 2, Wally, was asking a question that the client understands the BC connection. So the first part is their specific belief leading to the consequence. The second part would be more looking at, does this make sense to you that you're thinking, I should have bought her, I should have called her on her birthday, is what's leading to you to feel guilty. And so we want to do both, where we offer up, like you did, Wally, a statement that connects an irrational belief with the consequence, and then ask that they understand, because this is going to set the stage for everything we're going to do clinically going forward. Ask a question that checks that they understand the relationship of the way they think to how they feel or behave, the BC connection.
Great. Here's
Are you
another.
saying, are you saying that I met the criteria or didn't? Because when you ask if you agree, is that not a statement of inquiry into whether or not you agree, whether you're thinking along the lines I am? And if you disagree,
Love that question, Wally. I would say you met criteria 1, absolutely. Criteria 2 is more of the larger picture. Do you understand how you're thinking this way is what's causing it? You offered up a hypothesis in number 1, Wally, their specific belief leading to emotions. The second would be, do they understand that the way they're thinking, I should have called, lead them to feeling guilty, and then end up doing an unhealthy behavior like buying an expensive gift. So criteria 1, I would say, Wally, slam dunk, met that. Criteria 2, I would really try to make sure the client understands the BC connection, not just using this specific example, but in general, the way they think is what's causing them to feel and then engage in that behavior too. You want to read another one? Yep.
Yeah, can we try another? Thank you. We've got a lot of them coming in. It makes sense that you would feel that way. Can we explore how you feel?
Okay, so let's look at the criteria. So it makes sense that you would feel that way. I like that. That is validating some healthy, hopefully a healthy emotion. But go back to our criteria. Does it make a statement that connects the client's irrational belief with the consequence? It's validating what they feel and then opening the door for exploration, which I love that. And this goes back to what Christine and Ray both said earlier. It's not, there's so much more nuance to many of the different things clinically, and you would probably do that in an REBT session. But when we look at these criteria, making a statement that connects the irrational belief with the consequence, what you're doing is validating some emotion there and then wanted to explore it, which is good. But I'd probably say it doesn't meet those criteria exactly.
I would go a step further, Mark. I think that when you ask that question, like, what else are you feeling? You can go off on a tangent real easily and not go back to the connection, because they might have multiple emotions. We've agreed to talk about the guilt. We're going to talk about the guilt and the ideas associated with the guilt. Sometimes a lot of other questions can take us on a tangent that prevents the client from focusing on thinking about that connection.
Great. So I just want to highlight something here. The feedback that you're getting from our experts here is, I think, really indicative of deliberate practice, because the responses we're getting from participants could all be good therapy.
Yes.
Right. We haven't seen anything that, oh, there's bad therapy or whatever. And in fact, it could be good REBT, at different times during the therapy.
Yeah.
But what the guest experts are aiming you towards here is almost like a precision, like one of those precision guided munition missiles where you're trying to hit, like a 6-inch target, from 4 miles away. And so you're getting very precise feedback. So during a session, you can be like, bam, bam, bam. Does that resonate, Mark? And Ray?
Yeah, I think that's terrific, because like the question, how else are you feeling, would be a good question at another phase before you set your goal. But here, it's not helping me accomplish this specific goal that we want to do.
So Tony, can I read one of Wendy's responses, and I want to
Yes,
have
please.
a brief dialogue about that.
Yeah.
And Wendy, what you responded is good. It makes sense clinically. It doesn't lend itself
Well,
as
can
easily
you
to.
can
Sorry.
you read it out loud first, please?
So Wendy Dryden had wrote that before I would do that, and I'm assuming, Wendy, you meant the skills itself. I would discover if the person's guilt was about doing the wrong thing or hurting his mother's. The A, not the B.
Mother's sorry.
Yeah.
Mother's feelings, I should have said.
Okay, right. It's not clear unless you get A really clear, then making the IBC connections weak. And Wendy, I love that comment. This is where Ray, Christine, and I would have many debates. Well, how do you just teach this skill without clarifying something else beforehand? And so we would do that. Wendy, you're probably right. Clinically, you'd want to clarify that. For the purposes of an exercise like this, where you really have a client prompt and a skill you're supposed to demonstrate, we are assuming you've done that already. And that's an assumption we're making, but I think it's a fair point, and this goes back to the nuanced aspect of it. When we focus on these specific skills, we're assuming the client's already done it, Wendy, but that's a fair comment.
This
Is that
is
clear? Yeah. Go ahead, Tony.
so we do a lot of training of we spend a lot of time training supervisors in deliberate practice, and we find this is one of the most challenging deliberate practice skills for supervisors to pick up, especially supervisors who, who've been around the block and been doing this, more than a few years, is the skill of narrowing down on very specific, discrete therapy skills so you can rehearse them repeatedly, because that's how how the skill really goes into our bones, so to speak. Right? How we get procedural memory of a skill is by doing it repeatedly. And if we start drifting, there's always 1,000 other very interesting and important things we can be doing in therapy. And the supervisor is constantly pulled. Oh, what about this? What about this? What about this? What about this? And so it takes a lot of discipline to maintain this focus.
Yeah. So I also like Ali Bin's response. And maybe, Alex, if we can pull up the slide again. So Ali had written, when you say to yourself, oh, I just lost the chapter.
Here, I can read it.
Sorry. Yeah.
Yeah, I can. Let me read it here. When you say to yourself that you should have called your mom and you didn't, you then draw the conclusion that you're a bad person. This ends up with you feeling guilty and buying a gift that you can't afford. I wonder if you can see how your beliefs impact how you feel and act.
Okay. So Ali, great response. I think criterion 1 makes a statement that connects the client's irrational belief with its consequence. What I love that you did there is you did the emotional consequence, guilt, but you also did the behavioral consequence. And that's one of the things that Christine was very good on within the writing of this book, is making sure we didn't only focus on the emotional consequences. Sally, you had both the emotional and behavioral there, which was great. And then a slight difference from Wally's from earlier, I thought that you made a more of a general comment. Do you understand how your beliefs can impact on your emotions and behaviors? Not just this belief that led to you feeling guilty and buying the gift, but the larger in general process of how we think causes how we feel or behave. And so I love that, Ali. Thank you for doing that.
That was a great job, by the way. I'm a big fan of the B in REBT, and I know that sometimes in our trainings, we focus a lot on the emotions. So great job to that participant to tie the irrational belief to the emotional and behavioral consequences. And to Mark's point, broader thinking styles that will lead to unhealthy emotions and maladaptive behaviors. So good job there.
If I may jump in. So the cool thing is that each of these exercises has 15 of these client statements, and each of the exercises has its concurrent respective 15 example therapist responses. So these REBT offers provide example therapist responses for every client statement in the book, which, when I was learning all these models, there wasn't a library of showing 15 examples of exactly the same skill. So I think this is actually a really good contribution to teaching the model as well. How about we try a different client statement? I'm going to jump ahead here. So let's see here, different example. Client says, if I ask her out on a date and she says no, everyone will know. And that would be really, really bad. just the idea of rejection is tough, but having everyone be knowledgeable about it would be too much to handle. So I won't even ask her. So let's give people a minute to try this one out.
And this prompt is more of an intermediate one. It's not overly obvious and it's not completely vague. So you get a sense, but I'd love to hear what people have to say in response to this, how they would respond.
Same skill criteria too.
Yeah.
Okay, here's the first one. I'm going to read it out loud. It sounds like you're saying that you can't handle being rejected by this woman, so you won't even bother trying to ask. Do you see how not asking her out is tied to your concern about everyone knowing that you were rejected?
Okay, great. So thanks, Beth, for doing that. I do like, again, the clarifying it at the beginning, that making a statement about their belief with their consequence. And you focused on both the emotional consequence as well as behavior, not asking her out. Though. I do think one of the things people could, get caught up in is what's the likelihood of our rejecting? Sure, we would do that in traditional cognitive therapy. That's not the skill here. Beth, you didn't do that, which is great. So I think it's skill criteria to make a statement that connects their irrational belief with their behavior and their emotion. You do label it as concern about everyone knowing. And I'm not sure concern we would label as, actually, depends on the client, but we would say concern is probably a healthy negative emotion. I think you did identify the frustration and tolerance correctly. I can't handle being rejected by this woman, but I think it'd be better for us to clarify what emotion they feel as a result of this, most likely anxiety, and then the behavior, not asking her out. And then clarify if the client is truly understanding how thoughts, and you do kind of do this at the end, how thoughts leads to negative emotions and behavior. So this would be one of those examples where I would say, this is a good response. We could practice this and then build a more effective response that truly meets the skill criteria. Would this response work? I believe it would, Beth. But if we want to look at building this skill, I would think we'd probably spend a little more time rehearsing different ways that we could say this too.
So Mark, just to do deliberate practice right now, why don't we ask her to try it again based on your feedback?
Yep. So Beth, you're on the clock now, Beth. Like, what
Sorry.
else would you...
Sorry, Beth. Sorry, Beth.
Let's give.
All right, I'll work on it.
Let's give Beth a minute to put her to write it in the chat so we don't put her on the hot seat.
So while she's doing that, I want to thank Alex for picking this one. It's sort of a simple skill, the basic idea that belief influences the way we feel and act. However, I find it's the one that therapists kind of assume when people come for training, like they already believe that, and therefore they don't work on it as much. They kind of think that their clients already believe it. So I find this skill to be one of the simpler ones that therapists are likely to not work on because they believe that the client will understand it. And it's one that supervisors tend not to work on because we think that you as the therapist already understand it and have it, but it's difficult. And Beth did a very good job of teaching this skill Socratically rather than in a lecture didactic format.
So it's the basics.
Yeah.
This is like a chord. So we've got a bunch more here. Thank you, everyone. Also, we're coming up on the last minutes of the webinar, so feel free if you have any questions about anything related to REBT or the book, please put it in the chat. So I'm going to read another one here. So when you have the thought that people may know you've been rejected by a woman, it feels like that would be unbearable, and then it paralyzes you. Do you see how thinking about potential rejection blocks you from acting?
Alexander, I like that questioning there too. And again, I'm going to bring it back to the skill itself, though. So you wrote, so when you have the thought that people may know you've been rejected by a woman, it feels like that would be unbearable. That's still frustration and tolerance. Too much to handle. It would be unbearable. And then it paralyzes you, or more specifically in this person's case, they're not going to act. They're not going to ask the person out. And so I like that. But then if you look at the second part, which you wrote, Alexander, which again, I think is a great question. Do you see how thinking about potential rejection blocks you from acting? Now, in REBT speak, the potential rejection may happen. We know that's possible that that could happen. But I would probably think, Alexander, it might be more effective and meet this criteria to say, do you see how thinking about how terrible or how difficult it would be to be rejected and everybody knows and you couldn't stand it, that stops you from acting. And that's more, so again, it's not the rejection itself, because rejection can happen. That's the classic Ellis story about asking 100 women out and feeling his own frustration tolerance there. So it's not even thinking about the potential rejection. The idea that this potential rejection is too much for me to handle, frustration and tolerance, that probably causes anxiety. That probably blocks them from acting. So first part, I loved Alexander. Second part, if we're looking at the criteria here, you and I might have practiced saying that a little bit differently too. Does that make sense, Alexander?
We've got a second round from Beth.
Okay.
She stepped up to the challenge.
Good,
I'm going to
Beth.
read it out loud.
Okay.
It sounds like you're saying that you can't handle being rejected by this woman, so you won't even bother trying to ask. Can you speak more about what it would mean to you to be rejected by her? What would that feel like? How could you respond to that?
Beth, love that tip. So, but it sounds like I'm going to come back to the criteria. Beth. First part there, great summary, right? Saying you can't handle being rejected, frustration and tolerance, the consequences, not even bothering to ask her. The second part that you have is inviting a greater clinical discussion. And Beth, you would do this in a therapy session. Can we speak more about what it means to be rejected by her? Because then, Beth, your hypothesis, I'm guessing, and I might be inclined to agree with this, that what does it say about me? Everybody knows I was rejected. It means I'm a loser. And it seems like you're going down that direction and then trying to elicit another potential emotion that they might feel if they really did think that they were a loser because everybody knew they were rejected. Beth, that is great clinically. I would go back to our skills of focusing really just on connecting the B to the C here, and then do they understand how thoughts lead to unhealthy beliefs or irrational beliefs lead to negative emotions and behaviors. The last part you do there too, Beth, how could you respond to that? I love that too. That's problem solving. Like that's how would you handle it emotionally? What might you say? How would you deal with it? I love that. Before I would engage in some of that, I would try to make sure they understood the BC connection. So Beth, again, your opportunity here, your example here is good and probably a perfect example of what deliberate practice would be like. If we want to work towards these skills, how do they, so Beth, this is good. This is great clinic. This would work. But if I want to build this skill, maybe I get a little more, focus on the criteria and try to challenge them too.
This is also a wonderful example of how in deliberate practice, we have kind of 1 foot in theory in case conceptualization, and then 1 foot in experiential learning.
Yeah.
And so you'll notice there's a lot of conceptualization, there's a lot of theory, there's a lot of really interesting kind of theoretical meat we're chewing on, but it's all grounded in experience. And we found that this kind of learning, and the research suggests this kind of learning is most likely to kind of carry with the learner into the session with the client. Yeah. I think we got time for one more here. I'm gonna read one more. Sounds like the idea of rejection and having everyone know about it would be an intolerable experience for you, preventing you from asking her out. Does that make sense?
Okay. So Wilson, thank you for that. Again, first one is a nice summary. The idea of rejection, if you just had that part, I would probably say you didn't meet the criteria. But then you have the idea of rejection, have everyone know about it would be intolerable. That's the irrational belief, Wilson. So I think that's great that you have that there. So you're linking the intolerable perception of this to the behavioral part, not asking her out. So I think you met criteria 1, then asking if that makes sense. That's somewhat criteria 2. I would then take it a little more globally, Wilson, and say, do you understand in general how the way we think impacts our emotions and behavior? So that would be criteria 2. Yours, if I was grading, Wilson, the second part, you're like a solid B. If we want to get an A there, we'd probably then make it more specific towards, do you understand, Wilson, as a whole, how the way you think is what leads to some of these emotions, or in your case, behaviors, not asking for that too.
So I would take a skill that I learned from general semantics theory for here, which is we want to have a general statement. Certain beliefs lead to more disturbed emotions. And here's an example of that, so that we have a concrete example of a general principle. And I think that sometimes when people teach the BC connection, they can focus on a specific example and forget the general principle.
Can I
There
ask
I go, adding another skill. Can't.
Can I ask a question here of any or all of our guest experts? You know, deliberate practice at face value often seems kind of simple. In fact, some people are like, "Oh, this is so simple. These are basic skills. What's the point?" But I think what we're seeing is there's a lot of nuance that can come out. There's a lot of texture that can come out, right? I mean, all these responses have, you know, no one has been a beginner at REBT here, right? We're getting some pretty rich advanced. And I'd be curious to hear you describe your thoughts on that.
Well, I would say, you know, having been at the Albert Ellis Institute and worked for Al for many years, I would get letters from people that said, you know, I attended 20 of Albert Ellis workshops and I wrote every one of his books, and I think you should grant me a certificate because of my experience. And being the love slob that I am, I would say, send me in a recording. Let me hear you do it. And people who had loads of conceptual training just didn't do the skill. Very experienced clinicians, well involved in listening and reading, but they never did the skill. So I could give you hundreds of cases like that of people who didn't do it, although they knew it.
And I think with experience and feedback, especially from a training perspective, giving feedback about working towards some of these specific skills, people develop their competency in these skills, you know, and people hear that they hear the first should and they run with it, but that may not be the disturbed or the dysfunctional irrational belief, or they hear a negative emotion, oh, they're worried. But if you look at it, it's really just concern, which is probably helpful. And so I think getting this feedback and working towards a specific skill, then it integrates within all aspects, you know, of REBT skill. You know, and talking with Ray and Christine the other day, I used the example of a golf swing. You know, there's many different complicated parts of a golf swing. You work on each part separately. But if I get really good at holding the golf club, but my swing is awful, I'm not going to be any good at playing golf. And so it's working on each of these skills to then build the coherent, larger picture of, you know, hitting long drives, being the most effective REBT clinician we can be.
Great, thank you. We do have to wrap up. This has been a great webinar. Thank you very much to our guest experts. This has been wonderful. Thank you to our participants. The chat has just been scrolling with I only got to say out loud less than half of the responses that people put. If all three guest experts, if you could please put your contact information in the chat or your website or however you prefer people to reach out to you. And then we can put that in the video recording as well.
Yeah. And I just got Tom Murray's. Tom, if you want to email me, I have a whole lecture I do on competency doesn't mean effective. And so we could talk further about that topic.
That's an important topic.
Yeah.
Wonderful. So this recording will be on YouTube, so you can revisit it. And yeah, last word is if you think you can do it well, try doing it to get better at it.
Send Ray your recording and he'll send you a certificate.
Okay. Yeah, that's it. We'll do it.
Ray, I'm still waiting for a certificate though.
Okay.
Talk to Christine. Talk to Christine. She'll get it for you.
Awesome.
Alex and Tony didn't ask me to say this, but they do a supervisory training that I participated in the pilot training of. And I found it so helpful to reconceptualize how I do supervision in terms of skill building. And so I think if you get the opportunity to participate in any of those, I think you'll find it very helpful.
Thank you, Mark. All right, everyone.
Thank you, everybody, for attending. Thank you,
Thank you,
Tony
all.
and Alex. Thank you so much for
Our pleasure.
dealing with us.
This was great. This is fun. What a great community.